my computer, and I could always send you a copy.
That would be great.
So I'm here with Matt Veronica, and Matt is, in my opinion, one of the best people in the area, in not just in physical therapy, but also in strength and conditioning. I love talking to Matt whenever I get the opportunity to. I'm one of his patients. My son is one of his patients. A couple of my business partners have been to him. I've sent a number of my clients to him. And universally, it always helps people feel better and move better. And so that's my introduction to Matt, but we're just going to kind of like wing it here as a loose interview. And hopefully, we're able to pass on some insights to all of you who are, most of you are hoping to be in Matt's position someday as a physical therapist. So Matt.
Kind of cut out for a second there.
Oh, did I? Sorry. Hopefully you'll come back.
Can you hear me right now?
I can hear you, but your screen's not moving. It's frozen. Are we good? Uh-oh.
Oh, there we go.
Oh,
okay.
There we go.
Are we back?
Yeah,
I was about
we're
to
back.
say we froze. Okay.
We're back. So,
okay.
Okay. So, yeah, tell me a little bit about yourself. So, first off, where did you grow up?
I grew up in Tonawanda, so I'm a local guy. I went to Kenmore East High School. College, I went to Canisius for a year and then went to Duville for the rest of it. So I'm pretty Buffalo, born and raised. And then coming up through the Duville ESS program into the PT side of things. The only time I've really been away from the city was for a 3-month clinical in Cincinnati in college, and working at Bill's training camp in Rochester for 3 months. So other than that, I'm Buffalo full time.
You're settled in, huh?
Yeah, I'm comfortable. I'm not leaving.
Were your parents originally from Buffalo too?
Yeah. My parents are from here. My mom moved around a little bit, Virginia and Oklahoma and stuff, and eventually came back. My family's been in Buffalo since my great-grandmother illegally immigrated across the Peace Bridge from Canada.
And why was she forced to go illegally across?
They actually fled Italy when Mussolini was in reign there, because there was a specific police officer that they were fearing their lives from. And so they got up in the middle of the night, took a boat to America, got rejected from America, went to Canada, found their way to Fort Erie, and then eventually walked over.
Yeah, it's interesting. My grandfather was a smuggler. He helped people, kind of get into the U.S. illegally for years.
And I wonder if they teamed up.
Yeah, you never know. They might have. Yeah, he worked mainly with Irish immigrants, but a number of them were kind of on blacklists, and they weren't allowed to come in based off their activities, political activities in Ireland. So, he had this ring set up and would smuggle people in and help them hide and help them get set up once they were here.
That's awesome. That makes me feel so much less cool about what my job is now.
Yeah, I know. And here we are just doing this boring stuff, But so what in your background kind of do you think influenced the interest that you developed in physical therapy and strength and conditioning?
So I was always really involved in sports, forever playing organized hockey and soccer and baseball, and outside of that, doing anything we could recreationally. And I probably always, if you asked me as a kid what I was going to do when I grew up, I was like, I'm going to be a pro athlete. That was the easy part. The only hard part was choosing which sport I was going to go pro in. And then when I'm riding the bench in JV, then I start to realize that might not be my route anymore. So then I was kind of well, how can I maintain some presence in the world of sports if I'm not the one on the field? How can I be a supportive role? And you'd take little questionnaires in high school about what jobs might work out for you, and physical therapists would keep coming up, and I didn't really know what that really was. I had like Oscar Schlatter as a kid, and like my idea of PT was like some lady who like puts ice on you and makes you stand on a balance board and hooks up electric stim, and um, so I didn't really know, like I didn't really see that as like exactly for me, but it was the least bad of all the other options it was giving me. Um, and then getting into like, I didn't realize until I started getting into PT school of like what it can be, and which is so broad. It could be anything from like helping people who had a hip replacement learn how to walk again, or it could be like figure out exactly why someone has a very specific elbow injury only when they throw their curveball. Um, and that was, I remember when I was at DUville, we had an internship where it was like observational, like 5 hours or something. And I found Train Smart Personal Fitness.
Yeah.
This trainer, Joe Fox, was working there. And so I observed there, and he was paying Chris Nentars to come teach him how to be a better trainer. Chris is now who owns my company, MoveWell. So I got to observe with Chris, and he was like, that time he was running late because he was coming from San Francisco, where he was consulting with Adidas on how to make their minimalist footwear, and then came there, and he did a PT evaluation I got to watch, and he was like, I remember he had someone in like this kind of position. He was like, watch what's about to happen. He like bent their wrist back. She's like, my whole arm just went numb, and I was like what?
What's going
Like
on?
this guy's a magician. Like this is like crazy that he knows the body like this. And that was like my first experience of like seeing how the depth of understanding that someone can have of the way the body works, and like seeing it in this system of machine, and like playing detective of how to figure out exactly like what's wrong and like how to address it. And that like really appealed to me. I was lucky enough that I was already going down the PT route by that point. um, so it's not really that changed my like course of what I was going to do for a career, but it changed my understanding of what it could be and like where I wanted to go in PT. To now I'm with him, Chris's company, and I'm doing that kind of stuff where I love playing detective and figuring out like what's going on that other people can't figure out.
So do you get to do that? Like, do you use like a standard assessment, or does it really just depend on who presents in front of you and what they have going on?
I'd say for the most part, it's pretty individual to like the situation of who's in front of me. That being said, we do have kind of a we've got what we call a movement competency exam, which is like kind of like the functional movement screen and selective functional movement assessment. It's kind of a fusion of a few things, and it kind of is a selection of movements that we want to see everyone be able to do. Full body things, full body flexion, extension, rotation, squatting, arm, shoulder mobility, things like that. Um, but other than that thing which we use to gain like, okay, how well do you own this position? That's like a fundamental human movement. Um, how easy is it for you? How's your mobility and control in it? And how symptomatic do you become when you're there? So we kind of use that as like our um, check engine light. Okay, something's going on here. And then we look under the hood, so to say, and break it down. And that's more, now it's like, okay, um, someone having a knee injury versus a shoulder injury versus a wrist injury versus neck injury all have different testing sequence that we lead them down. Uh, in general, we kind of look at all the active ranges of motion that region has and associated regions that could be leading to it. We look at like the strength capacity of it. Try to do something that looks, compares symmetry side to side. We'll do a few like um, maybe like they call them special tests, things that are like, okay, so we've looked at the strength of the region, but let's do this test that would exactly trigger pain if the shoulder hurts because there's subacromial impingement, or if there's a different test for if there's a labral tear, and a different test for like a supraspinatus tear, or every structure we can kind of like tease a little bit more precisely. Um, so that's kind of our general method is like global movement, capacity of the region, and then provocative testing. And throughout that process, we look to figure out not only like what is uh, causing your symptoms, but also what dysfunctions are present that we can address, specific mobilities. For example, someone having shoulder pain when they pitch or when they bench press or something, we might see that they have like very compromised thoracic spine mobility, and that if they don't have enough ability to twist through the thoracic spine, that's going to put extra pressure on their shoulder. Maybe that's a contributing cause. So we'll look to uh, address the associated dysfunctions, and then
Mm-hmm.
also look to apply some therapeutic techniques to the symptomatic region. A lot of times the thing that hurts someone is like the victim of that situation of dysfunction elsewhere, and that's trying to pick up the slack and do more than it's supposed to do. I'll draw up this metaphor. Like, imagine you're in office work and you've got like 3 coworkers, um, and Bill and Sally and Jennifer never like do their job, and like they're slacking all the time, and they're taking extra time at the water cooler, and they show up late and they leave early. uh, Eventually you're doing all the work they should have been doing. You start to get like you know too tired and frustrated and irritable, and then eventually like Jennifer gives you hey, I think I'm going to go on vacation next week, can you do this for me? And you like blow up, and you you know you yell at her or something, and they'd be like, oh geez, Matt's got some weird problem going on, he's an issue here. And it's like, well, Matt's mad, but really Bill and Karen and Jennifer are the issues that need to, if they were doing more of their work, Matt would have never got pissed in the first place.
Right.
So that's kind of like the approach we'll take for.
You're the aggravated tissue.
Exactly. um, and then a big part of our assessments are like, before all that movement stuff comes into play, we do like we call subjective history. So it's just face-to-face conversation, asking anything from like, I kind of want to get their story. I'll really leave it open-ended. Sometimes I'll just say like, tell me your story. Start from the beginning. And then where people choose to start that is already indicative to me of like what's on their mind. We want to know things like how long it's been going on for, like what was your, for me, I get a lot of athletic clients. So like, what was your training in your sport like before this happened? Do you remember what caused this? How long ago that was? What is it you feel? What's that feeling like? Where do you feel it? Is it always in the same spot? Is it always that same quality of sensation? How severe is it? How long does it last? Is it only after you do certain movements, or is it kind of all the time? Is it different times of day? Is there anything that you can do to reduce those symptoms when they do come up? Am I the first healthcare practitioner you're seeing for this, or have you tried going elsewhere? Oh, you went to 2 other PT places and your chiropractor first. What did they do for you? What worked? What didn't work? That might be a different situation than if I'm the first person in that situation. Who's your trainer? What's your training? Kind of like, do you know what phase you're in? Are you in like a work mode? Are you in like a deload block right now, or is it in season? So, have you injured this area before? Is this a recurrence of a past thing? Oh yeah, if so, then what helped it last time? That kind of information is all what I want to like find out in that time frame.
So it sounds like you're looking at the person as a whole, and you're trying to get a perspective of them on the whole, and not only what are their symptoms at this moment, but what was the history that led to it? What are the personal factors that could be influencing how they're feeling this pain, or how they're feeling these symptoms, or how they're interacting with these symptoms? And do you ask about other components of their health too, other than just okay, you're an athlete and we're doing this sport, and now you're having difficulty performing one of the basic functions in the sport because of pain in a certain area or whatever. Do you follow up with other questions about their health to try and figure out, like things about sleeping pattern and, whatever?
Absolutely. So there's always a few like red flags that we try to keep an eye out for, which would be like, if something's a medical issue, we want to know that before we even start to try anything PT related. Are you having like, um, if it's like calf pain, like we want to make sure it's not like a DVT, like, hey, is this area red and hot and swollen, things like that might jump out. If it's like a back issue, it's like, all right, are you having like loss of bowel and bladder function? Do you have do you have numbness down both legs? How long has it been like that for? Fever, nausea, like things like that accompanying issues are like maybe more of a sign that we need to refer you to a more medical situation. Um, Other than that, like health things that I look at are, like how often do you get sick? What's your sleep quality like? How long do you sleep at night? How often do you wake up in the middle of the night? What's your like routine like before going to bed? Do you meditate? What's your nutrition like? What's your hydration like? Uh, have you been like struggling if they're trying to like add weight or lose weight? Like how's that process going for you? Do you generally feel pretty fresh, or like when you show up to the gym, are you like kind of already worn down and like resenting that? How energetic are you throughout the day? Or are you running on E all the time? Like how often how much are you relying on like caffeine to get you through the day? Uh, that kind of stuff. Seeing how a lot of people kind of normalize a lot of aches and pains that on some extent we all kind of get a little bit of aches and pains, and it's like we don't want to play into that too much because some of that's like comes up and we don't want to like be too fragile mentally.
Mm-hmm.
Other people, like, I'm shocked by how much pain and discomfort some people have normalized because they don't view like these repeated injuries and aches and pains that come up as anything wrong. They just view that as like, oh, I'm just, I'm 35 now, I'm getting older. And I'm like, you're not like old enough to be
You're
having
not
that
like
pain,
45.
yeah, yeah, or like 95 or something. So I think the way I don't get to all those questions with everyone. Um, if I had 6 hours with every person, I absolutely would. But there's some
Now with that, and in relation to that, you do get more time with your clients than most PTs get with their clients. Could you tell me a little bit about that, a little bit about how your structure
yeah,
is different?
absolutely. So a standard physical therapy outpatient office. So the lens most people have into the physical therapy world when they think I want to be a physical therapist is local, really well-known places that operate like that are Sports PT, Buffalo Rehab Group, Excelsior Orthopedics, University Orthopedics. There's plenty others, and they all, for the most part, they all do a good job, and um, their setup is that they take insurance. They're in-network practitioners, and so based on reimbursement rates, meaning how much money does an insurance company give you for each session you have with the patient, they choose in Buffalo on average to give $45 per session. So between rent of the facility, between having software programs and secretaries and management and all this equipment, things like that, to stay in business, they have to generally see about 4 patients an hour. 4 is the legal max. That actually is a number that gets relatively often exceeded, from what I'm told from therapist friends of mine in the area. But that's kind of the expectation that you might have one-on-one for like a few minutes during the first initial evaluation before you have to run out and work with your other people. But every other time is just going to be like, you might be teaching someone how to do an exercise while you've got someone else on the bike, while you've got someone else putting ice on their knee, and someone else you're trying to like say, hold on, I'll be with you in 5 minutes. You're kind of running around trying to balance and maintain numerous patients simultaneously, which is necessary in that system to stay in business and to service as many people as you can. As a negative byproduct of that, quality of care tends to decrease with the less attention that each individual person does get. For most people, that system still works out pretty well. But there are a lot of people who don't have success in that situation, whether that means that they never got a thorough enough evaluation to actually figure out what their diagnosis was initially, or they don't get enough personal attention to guide their progression of treatment adequately, their technique of, they might be over there on the wall, with the TheraBand doing external rotations, but instead of like turning this way, they do this kind of thing. And what went from shoulder rotation quickly became tricep, like elbow extension. And, 30 feet away across the room, the PT never, didn't get a chance to see that. And the person's wondering why they're not getting better. Some people just don't like that environment, being around, um, that many people. Even if it worked and healed their condition, they just like didn't have that positive experience. And then probably the last thing is that people recognize that their therapist might not always know their craft. Like maybe they're not a weightlifter or not an athlete or not a runner or not a yogi or whatever. And, it's like just not specific enough to them. So essentially what my company serves to do is to be that option for people to have all the personal attention that they want, and to, when someone shows up with me, we are all one-on-one the whole time. It's just them, it's just me. There's no assistants that are like working to, to help out, and there's, no other distractions. And so we can get a really quality evaluation, and we can get really quality exercise instruction. We can do quality manual therapy in that time. And it just gives us a lot more freedom and ability. The negative side of that is that we can't accept the insurance reimbursement rates to stay in business. So we do out-of-pocket pay, private pay, out-of-network, however you want to term that.
So when people look at the price of one session, it might seem to them like your session is more expensive. But when you really, having been a patient of yours and having my son be a patient of yours, what I've come to realize is that you are just as much an educator as you are a physical therapist. And so like when I bring my son to you, you spend a lot of time with him and you teach him how to do the exercises with a certain level of precision. You teach him about the intensity level that you want him to go with. You teach him, about the small cueing points that he should be looking for when he's doing them. And so he comes out of that session with a lot of knowledge about why he's doing something, how he's supposed to be doing something. And then he can then, maybe meet with you like, 2 or 3 times, and then be pretty self-sufficient to go off on and utilize that program for a number of weeks before it has to be progressed and we bring them back to you for another visit. Is that, am I right about that? Like, do you view that as being, because ultimately, like I brought my son to traditional physical therapists too, in a traditional setting, I should say. And in a traditional setting, like he might end up having 12 to 15 appointments, and he doesn't really understand the underlying reasons why he's doing something. He doesn't understand how to perform them. But just with 2 or 3 sessions with you, he has a whole different level of personal responsibility with it. He follows through. I mean, he's still, we haven't seen you in probably, I don't know, 4 months, 5 months. And he does his program all by himself, every day. He's faithful to it. And it's, just helped him tremendously. So I see like what you did with him providing a lot more value than what I did when I was paying $20 per visit at the traditional office.
So yeah, absolutely. So I see kind of 2 phenomenon going on within that, one being like an educational side, one being an economic side. Economically, people would see our prices and say, oh, that's triple the cost of what it costs at the regular outpatient physical therapy place. Why would I pay that? And I'd say, well, they're going to make you go 3 times a week and you might be there for 6 weeks. Whereas with me, you'll only have to come maybe once a week and you might be better in 3 weeks. And so ultimately you paid half of what you would have paid otherwise, and you took 25% of the times you would have otherwise gone into the clinic, maybe less than that, maybe 15, who knows. But so if it, there is a opportunity cost of driving to a clinic and spending your hour there, and you only get 15 minutes of FaceTime with your therapist when you are there. and then you drive home, and the economic cost of handing over your copay, and maybe your deductible hasn't even been reached, and you don't even get any assistance on it, and then in that case, that session might cost even more than mine did anyway. So I think I strive to get people better in as few sessions as possible, and that might mean that might be anyone who comes, once or twice a week for 3 weeks, or it might be like, hey, I just want to come one time and just like learn a program and have a strategy to go on, and then just come once. And I'm super happy to do that, because I think that is far more cost effective than just showing up to the clinic 3 times a week for 2 months. And then the educational aspect of that is when you like the why, like the understanding of the situation, like the reason you're doing it is so much the driver. And so part of that is how, like, the perception of what your pain is. There's like in Scooby-Doo, like they see this monster and then everyone's freaking out, and then they take his mask off. They're like, oh, that's just that guy who's the assistant custodian dude. Like, he's no big deal. And it's far less scary. And like when you understand your condition, it doesn't hurt. Actually, I remember having like this mouth, like cheek gum pain, like over the summer, and it was just killing me. And I looked in the mirror at like a few hours later, and it was just like this little canker sore. And I was like, oh, that's all it was. And it literally like didn't hurt as much after I knew it was just this little small thing. So I think like people sometimes physically feel more pain when they are like unsure of what that pain is and like why that's happening, because it is scarier, and there is a psychological aspect that increases that pain phenomenon. And then B, the other part of that is when you understand like what's going on, like what is hurt, how that thing is hurt, how that thing repairs and gets better, and what you can do for yourself to manage that. Here's exactly what this, we're not just doing, hey, do 30 of those, do 30 of those, do 30 of those. We're saying this drill is anatomically doing this for you, and this is how you should go about it. This is how it should feel, and this is what it will be like when it's going right. And here are the common errors that might happen for it, and this is how you'll notice that those errors are happening, and then here's how to correct them back, and like really like explain that, so you're the owner and the driver of that situation. And I'll also tell everyone, if you forget how to go about doing that, like, here's my personal cell phone number. I'll film myself doing it and send it to you. You can swing by and ask me in person. I also can find a YouTube link and that represents it well, and then text that over to them. So I want to continue to be like that, like a resource so you can continue that process independently.
Yeah, I feel like that personal ownership part is something I really noticed with my son, and comparing the experiences that he had at different sites. And when he worked with you, he took it on as him taking care of his body, where before he was like viewing it as, oh, I go to the physical therapy place because they fix me. And he kind of like had that shift in perspective where it put it on him a little bit, and he understood why he was doing things. And I think all of that came together to be a really good recipe for him. And maybe that's not, where everybody's headed, but I think that that's a great attitude for a young person to start to establish that, hey, your health is in your hands, and it's the decisions that you make on a daily basis, the activities that you engage in on a daily basis that are going to make the difference.
Yeah, I would say there are people who aren't so like self-motivated, who do want to rely on someone else, who don't want to have to think about exactly how to do it and what to do. They just want to show up and like be guided through it again. And to some extent, I'd like to make them more empowered, but I also want to like kind of meet people where they're at and like be that option if they need it. But I would far prefer like the journey your son went down as a high schooler, to develop that level of self-ownership and responsibility to realize you've got the control to make as much or as little progress as you want to make. Like, that's in your hands. I think that's a lesson that is easily able to be extrapolated to many other avenues that he's going to encounter during the next few years.
So, traditionally when you come into the class and talk to everybody, we have the topic of mobility. And mobility is really interesting because, when we, in this course and in most of the courses that the students are in on the ESS side, they get exposed to the, 11 components of fitness that American College of Sports Medicine puts out. And one of those, one of the big five, I guess, the health related components is flexibility. And for years, there was I remember when I entered the field, which is, I don't even know if you were born yet, but I'm just kidding. I hope you were born at that.
When was it?
I guess I started full time in like 97, 98.
Yeah, I was like 6 or 7 years old already.
Yeah, see? So, so around that time, flexibility, a lot of emphasis was put on that. And we would strive to just get people into endpoints, end range of motion points. And that's really changed in the field. I mean, to the point where I would almost think that ACSM should be at a point where they maybe change their guideline from a flexibility guideline to a mobility guideline. Could you maybe touch upon that? Like, what's the difference between them? And
sure. So they are, for the way that they'll be looked at for a lot of people. I know they're almost synonymous terms, flexibility and mobility. Really, the difference that we want to draw is that flexibility is a quantitative measurement. It's about how far can you move a certain direction, and mobility is a qualitative component to that. It's how well can you move through a certain flexibility with control. So it's control demonstrated through a range of motion, not just that range of motion itself. And it doesn't mean that that range of motion is not valuable, because you can only have mobility as far as you are flexible enough to achieve. You can never have more control of like muscle activation past a point where you have flexibility stopped at, if that makes sense.
Mhm.
So,
so the quantity could be reduced by flexibility.
Yes.
But
Yeah.
The quality is determined by mobility.
Yes, exactly. So if it's possible, so let's say mobility is the combination of flexibility and control.
Mm-hmm.
So if someone has poor flexibility, they're also going to have probably poor mobility because they can't control very far. It's like if I can only bend my elbow this much and I'm missing all of this here, like I have poor flexibility and I also have poor mobility because I can't control any further past that point too. So mostly what we want to make sure we avoid is the tendency of just working to develop flexibility. Because if we arm you with greater range of motion, but don't do anything to develop the control through that range of motion, it's kind of, it could be wasted. That like, it's like your body essentially doesn't quite literally your brain might not realize you have that. So when you go that new flexibility, because its default is set to a lesser degree of motion. And so if you never do, like if you do a stretch, theoretically, let's say you pick up 10 degrees of motion. If you don't do a functional movement through that increased range of motion, your brain never realizes it can recalibrate its mobility. Mm-hmm. So maybe it doesn't matter that you just stretched your shoulder more before you went and played baseball if you never followed it up with like some muscular control through that range of motion, because when you go out to pitch, it's not even there. So we want to make sure that we definitely do some flexibility work. We just make sure we follow also in that program include motor control through that flexibility.
Awesome. So the paradigm that we used earlier in the semester when we talked about corrective exercise was we used the NASM's model, which basically has inhibition as the first step, and then range of motion work or lengthening work as the second, in essence, some form of stretching. And then the third is activation, which is generally isolation exercise where we're potentiating a very specific pattern. And then it ends with integration, which is, you know, just tying everything together and setting that neural pattern, like you're talking about, teaching everything, you know, teaching the nervous system that, hey, we just changed the relationship between these muscles in this chain. And so I know like the terminology, like you just used some terminology that would fit into there. And so if I remember correctly, the terminology that you tend to use is like tissue quality work.
Yeah.
So your tissue quality work would probably include either massage or some form of self-myofascial release or something. And in addition to that, maybe some flexibility work as well in terms of lengthening type work. Is that right?
Yeah, correct. So I love the sequence that you guys choose of how your inhibition comes before the the mobilizing portion. So gaining mobility for us, it could be different. So based on my assessment, so if I'm specifically working with someone, maybe it looks different than how I might like draw up a general program for the world to use. But we want to improve mobility. Sometimes we just need to do it through the musculature system. Sometimes we need to do it through the joint system itself, and how we approach those might be different. But most cases, let's say it's muscular. And so if we want to increase our range of motion through stretching, before we stretch, we want to like turn down the tone of the muscle, improve the quality of it. Inhibition would be like the phrase you use of turning down how much tension is within that muscle. Maybe it's just a muscle that's got a lot of tension to it. It's just kind of tight. Maybe there's trigger points within it that we want to release. Either way, a muscle is not going to extend as much as it could have if there's some neurologic tightness to it, or if there's trigger points within it. So essentially, like I liken it to like if you found a rubber band on the sidewalk. If it's like a August, that's going to be very elastic. If it's you know, February, it's not going to stretch quite as well. And that's how we look at the general warm up. But that kind of process is like, okay, say you found a rubber band in February. What can we do to like make it a little more elastic? Maybe, you know, maybe this metaphor is kind of losing it because it's more thermal. I take it back. More like, yeah, I don't need to go down that road. Essentially, we want to make sure that we decrease our tension before we go into the stretching of it. And then after that, like you're doing your activation work, which is trying to.
And I think you guys call the activation and integration kind of your corrective exercise, right?
Yeah, I could see corrective for us being maybe those first things fall into it as well. It's anything that like addresses some dysfunction. Maybe that dysfunction is lack of range of motion, but so I'd say it's
Together.
a big portion of what we would do, but not just exclusive to it. But essentially, yeah, as I say, our corrective work would be all of those things. It would be the inhibition work, soft tissue work, if you want to call it that, some stretch, and then followed by a muscle activation drill.
So let me ask you a question about that. So in very recent times, like over the last 2 years, you see more and more people dropping out the tissue quality work and going straight to activation. And their general argument is that while you improve the tissue quality and you change the relationship between the muscle that's been inhibited and maybe muscles that are overactive, I'm sorry, muscles that are underactive, and you've changed that relationship, that is so short term, right? That basically like just a dynamic warm up can wipe that out. And so people are saying, you know, the biggest bang for the buck comes from the activation and integration. So let's like skip that tissue quality work, get right to it, because this is the most efficient way for us to treat something. We're not, you know, we're taking maybe a 15-minute routine and breaking it down to a 5-minute routine. And could you, have you heard that, or have you followed that at all? And what are your kind of feelings about it?
Yeah, I think years and, you know, maybe more than 5 years ago, we were you know, we follow what the experts in our field say.
Mhm.
And like when that was at a time, Mike Boyle was saying that everyone needs to foam roll every major muscle group for 10 passes, as part of their warm up. Kelly Starrett was out there with like using a lacrosse ball for 2 minutes on all these different places and things like that. Um, and that's what was hot at the time. And now it's kind of shifting the pendulum to the other way, where people are kind of breaking from that reliance. Um, I agree with that movement to some extent, just like any pendulum swing. Like eventually, it's going to end up in the middle, right? So I definitely do still use some of that tissue work at the start when it's indicated. I think the trend we're realizing is like that's not that important for everyone, um, but for some people it is, and especially in my world, like the people I'm working with who have pathology going on, a lot of times that is still indicated. Uh, if I chose a random guy off the street, maybe he doesn't need it. But if you've got a specific injury that dictates that work, um, I'm still welcome to incorporating it. And I think that on a case by case basis, there's use to it in the way of if you need to improve your range of motion to make the workout following safe, then I think it's worth doing. Like if you're about to do it a CrossFit workout, you've got snatches in, and you need to have really good overhead motion. Um, maybe it's and if you're limited in your shoulder mobility, maybe for that person it is important for them to loosen their pec up before they start up, because they're limited in mobility already. If they're not limited, maybe that's not the best use of their time, and maybe getting into the active stuff is better. I think that active stuff does warm us up from the inside. That's more of the temperature coming into play and the elasticity that you're getting blood flow going, you're getting contractions through those muscles. Uh, your brain's getting in touch with them and getting uh, more control from like a brain and like a spinal cord recruitment of those muscles. Uh, your technique improves over time. Your brain's perception of how far you can move through, like how much mobility is willing to let you express, can improve along that process as the dynamic warm-up goes on. Uh, a lot of the inhibitions get wiped away, um, like maybe we don't need a hip flexor stretch, maybe we just needed that glute activation more, and then that like allowed the reciprocal inhibition of the hip flexors to decrease, something like that. So I do agree that I think the active component is far more valuable. If I had 5 minutes to do a warm up, it would all be active.
Yeah.
But if I've got 25 minutes to do a warm up, then maybe I'll choose to still hit some tissue work for me that's specific to the muscle group I'm about to work to get fluid dynamics of that improving, or like a specific area that I need to gain some mobility in.
Yeah, I think my impressions of the argument are almost the same as what you just described. So I think like you said, these pendulums swing back and forth. It was the last lecture that the students had was about the energy systems development, and I talked about how base cardio was something that just got wiped away at some point, and everybody was just doing high intensity interval training, and they didn't want to hear anything about building an aerobic base. And that pendulum was way too far over towards HIIT, and now it's swung back somewhat, and people, like you said, it's settling in the middle, where people are realizing, that aerobic base is a really good thing to have, and that it allows you to push harder during those intervals and recover better from those intervals.
Yeah, I think that's a great example of one that used to be that. I remember seeing pyramids in textbooks that the aerobic base was like at the bottom of, like that was the foundation, and that did kind of get eliminated by most people in there. I think at some point when people realize they're winded just doing their like warm up, they're
Right.
like, well, maybe you do, like maybe it's not the most important thing to establish, because if you had adequate endurance already, but if you don't have adequate endurance to do regular day-to-day stuff, if going up a set of stairs is making you winded, like you probably would benefit from an aerobic base. And maybe it's not even the expression of endurance that you're showing, but the way your ability to recover is also improved by having greater endurance throughout the day.
Right.
So even if you're just a strength athlete, you will grow strength better from having not running marathons, but being able to do a low level of cardio activity.
Yeah, absolutely. And it'll benefit your training because you'll be able to, perform more sets in theory and fewer in less time. So, you're able to get more volume in, and, in any given time period, which, in theory should make you more efficient at your training, if not, just better at fitting volume in, which is very important as an athlete advances.
Yeah, and that might be length of a workout, that might be number of sets in a workout, that might be number of training sessions per week.
Right.
They're all ways that having better endurance can, uh, help you out. But also, bottom line, if you've got a set of 12 because you're in a hypertrophy phase and your limiting variable is being out of breath instead of muscle fatigue, then you're not achieving much hypertrophy at that point in time.
Yeah, absolutely. Hey, so I know, one of the there's a few big things I think that, separate somebody like you in the field from other people. And one of them, I mean, obviously you were an athlete and that changes your perspective on things, but you also, chronically engage in movement, right?
Mm-hmm.
I mean, you're somebody who uh, practices what you preach, on a near daily basis. And that's something I'd really like anybody who I mentor to kind of understand. Like, how does that inform what you do every day?
So I think having the personal experience of guiding myself, um, not that you have to necessarily be the one guiding yourself. You can also be in the field and have a trainer or have your own coach, and those things are advised too. Uh, but to be going through it and to feel this is the intensity of a sport. This is the physical demand of it. This is the time demand of it. This is the training outside of that sport that's needed. This is how you feel after it. This is how you feel the next day. When you wake up from it. This is the financial strain of it. This is this is how it affects the relationships in your life. This is how it affects your social circles. To live that, from every aspect of it, I think is what helps to keep me very in um, able to connect to my clientele because I'm walking that path with them. It's very easy, I think, for someone who doesn't partake in that journey to make advice or claims from the outside that aren't practical because they don't understand uh, what that's like. And a lot of people that work with me are people who are not only uh, injured, but they're looking to continue their activity, continue their workouts. They're not satisfied because their doctor told them you should just stop lifting, you should just stop running, you should just don't work out, just don't lift anything over 5 pounds. And they're like, that's not a good answer. And I'm like, well, I understand why their doctor says that because I get the medical side of it.
Right.
But I think there's a better solution. We can find ways to bring you up in that. And I kind of get it because I've walked that myself too. And there's an emotional aspect of that also, to empathize with someone who's had a season kind of, now they're on the sideline because they're hurt, or they were really hoping to achieve some higher level of performance and then they are let down at how that a meet went for them or something like that. So I think that is probably the biggest effect of it. And then in that process too, I learn methods that work. Maybe someone can't pick up a textbook or go read on Google this strategy that's going to work for them the best. But I'm like, hey, what works for me when I'm doing a few hours of computer work, this is my little, every 45 minutes I'll get up and I'll do these 3 movements. Why don't you try that out?
Right.
Something like that.
Yeah. Yeah. I've noticed that the best physical therapists that I've worked with are all exercisers. They're all people who, have made a habit of exercising themselves and typically over a long period of time. And if they're not currently exercisers, they were at one point very chronic exercisers. And they understand what the exercises feel like. They understand, what the patterns uh, feel like when they perform them. It's not just a textbook knowledge, or I guess these days a digital knowledge from watching videos or anything like that.
Hmm.
It's the actual, experience of engaging in exercise that somehow separates, in my view, separates, you know, um, it can be a big separation between one practitioner and another. Um, do you agree with that? Like, do you think that personal practice informs so much of, your interaction with clients on a daily basis?
Yeah, I definitely. I would. Um, I would, if I had to give a percentage to like how much of what I do with each client is like what I got taught in class as opposed to what I've learned like from my other experiences outside of that. It's probably a lot more the latter, and it's you know maybe it's something as simple as like someone goes to an outpatient PT place and um, they've got a knee issue and they have them do leg extensions and then wall sits and then hamstring curls and then goblet squats after. And then by the time they get to goblet squats, they're like they can't do them or their knees flared up by then. And it's like, well, maybe something as simple as like in first year of undergrad in ESS, we learned like put your complex the more compound movements towards the start, so you're not limited by the fatigue of the isolation drills. Little concepts like that that are just like not on the radar of people who don't have that exercise experience. Um, a lot of the like in PT school, even the list of like, here's exercises that would help this injury. They're like just a list, and leg press and knee extensions and wall sits and squats are all, and lunges are all on there as like equal on their hierarchy. And there's not like, like any strategy behind them. Like hip hinging uh, is not something that was taught in when I was in physical therapy school. And like now Gville does have movement quality stuff that makes its way in there more and more functional things. So I'm thankful for that. But that's things that I knew from the fitness side of things before, and also to to be in college and be working as a personal trainer and getting the experience of like client management, interaction skills, coaching skills, things like that are things that are experiences that I got under my belt before I ever walked into a PT clinic, and I think that set me up for a lot better success, that I was able to hit the ground running after PT school in a way that someone who never did that, had that experience coming out of PT school, they're not only trying to figure out how do I fix this person's injury, but like how do I talk to someone with the demeanor of someone who's has the power role in that relationship, but is like nice and relatable. And how do I like get them to come back again next time? How do I convince them to want to, invest financially and time wise into me, and to gain trust, and to what do I feel the time talking to them about, and getting like little people skills like that down. And um,
Mhm.
so those are all things that are, uh, also helps from doing related, being the fitness side as a employee, even before PT was a big help.
Yeah, absolutely. That's it. Those are all great points. Another thing this semester I've been trying to do, and I started this last semester, but this semester I was off to a really good start, doing it even more before COVID hit us all. And it was trying to give the students a good reference point in terms of good sources of information or thought leaders in the field, that type of thing. And so, some of the coaches who you mentioned earlier, like Mike Boyle, we've covered, we've covered some of the West Side influenced people, some of the more functionally influenced people, starting from Gambetta and working our way forward.
Yes.
And so I was just wondering, are there a few people who you would recommend that the students start to look into and start to read a little bit.
Would you say more from a fitness side or more from a PT side?
Whatever you think will help them develop into a good professional. I took more strength coaches, and I didn't get into PT too much, but it's up to you, whatever you think.
Okay. Yeah, so I'd say from the start, like a challenge that is presenting itself to like students nowadays, it didn't used to be a challenge as much, like let's say in the pre-Instagram days, is that it's really easy now for anyone to go on and make an Instagram that looks visually appealing and they look like they're an authority or a reliable source when they might just be like some regular dude who just doesn't really know anything more than any other PT, who just happens to have a sister who took a graphic design course or something, so it looks good. But back in previous to 5-6 years ago, you had to be like, it was a lot harder to become an authority or to be looked at as an authority. So it was like you were able to more trust anyone who was like a big name, and now you have to be a little more skeptical and turn your filter level up a little bit higher. From that logic, people who were like already established professionals before are always kind of like more reliable to me. So like Greg Cook is a really good one from the physical therapy side. Like Mike Boyle mentioned, Eric Cressy is a personal favorite of mine. He's a baseball relevant strength and conditioning coach, but also has a great understanding of mechanics and things that even like I was studying his like shoulder mechanics information when I was in physical therapy school instead of like some of the textbook information that we had available to us. He's got a physical therapist with him named Mike Reinold, who's really smart also, but his services is I don't think his is free. Stuart McGill's a big one from the back, like the spine side of things, who I really follow a lot. There's in the podcast world, there's really interesting podcast out there called Stronger by Science, which is two PhDs who like to train, and they like break down research studies that come out and make them like digestible. There's a company called Barbell Medicine that is two medical doctors who are maybe it's more than two at this point, but they're medical doctors, and they give their who are also like powerlifters, and they give their perspectives on how to balance the health side of things and the performance side of things. Kelly Starrett's always a good one. There's Andrea Spina. He's a chiropractor who does a lot of like functional movement. Kind of the FRC course is his. There's a man named Ido Portal, IDO space PORTAL. He's Israeli. He's kind of a movement, I don't know, like almost like a philosopher of sorts, who's just got a lot of great thoughts on exercise and as it pertains to like our culture and society. So I could keep going on. It's getting tough nowadays. There's so many great ones.
I think of one thing that a lot of people don't, realize is that there is a strong history of attention to movement in Israel. The Wingate test was originated in Israel.
Interesting.
The Feldenkrais, which was like it was a form of physical therapy, really. Came out of that was developed in Israel, and that has it's kind of it related, I guess, to like yoga. There were some like primary patterns that they found to be therapeutic, and that's influenced a lot of our modern stuff. I mean, they were talking about thoracic mobility like a long time ago, and giving us exercises that were pretty effective and ones that we still pretty much use today.
Wow.
And so it's really interesting, the history of it, I guess. And maybe the older I get, the more I'm interested in that history, because I've seen a good chunk of it now in this field, where, I started really researching this stuff in the 1980s. And through all the night, by the end of the 90s, I was practicing full time, you know, and now here we are 2020. So I've been at this for quite a while, and I've seen all the different tangents that have come off and the different lineages that have developed in the field. So it's great to get those names from you and those sources of information.
Well, one that's maybe, now that you describe it all that way, a great one is Craig Liebenson. He's the
Mhm.
chiropractor by trade, but he studied in Europe with the developers of like the functional approach to physical therapy, Carl Levitt and Vladimir Yanda, out of Prague, I think they were from, and
Yeah,
studied with them.
his Instagram is fantastic too. A
Sure
really
is.
good Instagram. Yeah.
He's got just courses and all these things, and his whole method is to say um, Vladimir Yanda stuff works, Shirley Sarman works, chiropractic works, West Side Barbell works, Stu McGill works, Annie O'Connor's pain science stuff works. Like all this stuff works, uh, but like it's all very different. So if it all is having a positive outcome, what can we take from like each one to like a synthesized kind of into a great gain, a better understanding of all this stuff? What are the commonalities and what's like universally true instead of just for like a subset of the population?
The
So he's a really good fellow.
the Bruce Lee of therapeutic exercise, right?
Absolutely.
Yeah.
Yeah. So in general, I guess my advice would be don't let Instagram be your primary source of education because it's inherently limited in how much content it can apply and inherently limited in terms of like there's a bias. Like there's always going to be a bias that like anyone using Instagram is trying to also gain followers or maybe sponsorship or whatever. Um, so find like long form print text. It could be on websites, but something that's longer and really gives you an understanding of the situation. It's always, you can't understand any scenario in a 500 character
Yeah.
post.
And Craig's a good example of that, right? Because he has like this good Instagram content, and most of it's just like shot by himself. It's kind of like low tech
Mm-hmm.
presentations. But then, he also just had a textbook come out that he wrote. So like he's the type of guy who is a good source of information even on Instagram, although just by the nature of the short form,
Yeah.
he can't present all the reasoning that led to why he does what he does.
Right. I think he's kind of like we all have to now. It's like we all have to have an Instagram just to like be on that's almost like being in the yellow pages
Yeah,
used to be, I'm sure, right? Like he had to
sure.
have a presence, but like I'm sure he wouldn't choose that as his primary like platform to like learn from him in.
Right. Yeah.
So,
Great, Matt. Hey, I don't want to keep you any longer. I've had you on here for over an hour.
oh my gosh.
Yeah, between our pre-interview and then this. But I just want to really, really thank you as always. You're one of my favorites. So I appreciate you coming in and coming on here and helping the students
It's
out,
always an honor.
helping me out too. I always take good things away every time that we talk. So
Yeah,
thank you
you
very
always have
much.
excellent questions, and it's always an honor to be talking to you and your class and a lot of fun. So I appreciate it.
Great. Thanks, Matt. And
Yeah.
I'll be in touch.
Okay, sounds good. I'll talk to you soon.
All right. Thank you.
Good luck, guys.